speaker and speakers for today. So I'm going to introduce the PI for this project, and then she's going to hand it off to the rest of the team for introductions. So I'm pleased to introduce Linda Neuhauser. She's part of Health Research for Action, a really exciting group connected to School of Public Health that conducts all sorts of impactful public health projects, and they're going to share some of their work related to, I believe, wildfire smoke today. I hope that topic is correct. So Linda, I'll hand it over to you and welcome all of you to our seminar.
Thanks, Jen, and a big shout out and a hello to everybody who's joining us today. I first want to start with introducing some of our team who is here. We don't have everybody here, but Susan, I'll start with you. Susan Ivy. You want to introduce yourself?
Hi, of course, you get me right when I put a bite in my mouth, but
of course, I planned it that way.
Director of Research at Health Research for Action and lunch eater, apparently. So I'm here in the background. Thank you, Linda.
Yeah, and Susan is one of the co-PIs. Jason, another co-PI, Jason Su.
Thank you, Linda, for the introduction. I'm a full researcher in the School of Public Health. I have been working with the HLRA for a few years now. So for me, I'm supervising together with Susan and her master student, Emma, air pollution exposure modeling, specific focus on the impact of wildfire on those communities we are focusing or we are working on. Thank you.
Thanks. Morgan Vienne, one of our researchers.
Thank you, Linda. Hi, everyone. I'm a staff research associate at Health Research for Action and a doctor of public health student at Berkeley School of Public Health. I assist with the project and work with the team on various project activities.
Great. Winston Sang, another co-investigator. Winston, do you want to introduce yourself?
Hello, everyone. I'm Winston. I'm the Associate Director of Research at HRA. And yes, I also work on a number of components with the team.
Great. Thank you, Winston. Next, we'll go to Becca Freed.
Hi, everyone. I'm Becca. I am part of the 3-person communications team within HRA. And oh, Anthony's here, but his name says Morgan. Anyway, we help to develop some of the materials that you're going to hear about today. So nice to be here with you all.
Thank you, Becca. And Anthony Eleftherian.
Hi all, I'm Anthony Eleftherian. Sorry about my name. I wasn't sent a link even though I registered, so I used Morgan's. I'm Director of Communications at HRA. I lead strategy for content and informational design for all the products we create, which vary quite significantly from websites to booklets.
Thanks, Anthony. So I think we can begin. Morgan, do you want to share screen? Today, we're going to talk about our EPA-funded participatory design of effective risk communication about wildfire smoke for hard-to-reach populations. So, as many of you know, wildfire smoke is a huge health problem in California, the Western United States, and now many other places in the country and in the world. And so our group was fortunate enough to be awarded this US EPA grant to look into how to best design and get out risk communication about wildfire smoke, especially for at-risk and hard-to-reach populations. Next slide, please. So these are the 4 objectives that we have for this project. And the first one is to create a new, more precise model of California wildfire smoke risk data, including for vulnerable or high-risk populations. And Jason Su will tell you more about this, but the basic problem here is with the limited monitoring of wildfire smoke and basically air quality in California. We don't really have enough information right now to know the impact of exposure, especially on maybe the rural and hard to reach populations in California. So we are setting about to do a better model to fill in some of those gaps. The second was to conduct a needs assessment of wildfire smoke risk communication, and that included a literature review and an environmental scan of existing materials. When we started the project, we couldn't find any comprehensive literature review about wildfire smoke risk communication. So a lot of gaps in this area, even though there's a lot of new information emerging, especially over the last 10 years. Our third objective is to use participatory design to develop or revise risk communications and dissemination strategies for hard to reach populations. And we also wanted to conduct a continuing education course for healthcare providers because, as many of us know, even though exposure to wildfire smoke is a very big health risk, even a lot of healthcare providers don't know enough about the impacts of those risks, especially on, let's say, cardiovascular risks and so forth, risks to infants, pregnant women. A lot of that information is new. And fourth, we are set about to test the usability, acceptability, and effectiveness of these new or revised risk communications and dissemination strategies using usability testing, focus groups, interviews, and surveys. Next slide. We like to begin all of our formal meetings with this acknowledgement that UC Berkeley sits on unceded Native American land and that we are committed to supporting tribal nations in making things better. Next slide. The next thing we do is we go over our community agreements. As we know, we are all committed to inclusion, diversity, and equity in our school. And we also strive for that in all of our projects, sort of a continuous learning approach. We all make mistakes. So when we do make mistakes, we want to address those mistakes and do better next time. We have these community agreements with all the stakeholders and community people we work with. Next slide. Here is our team. You see some of us here today, and but others are not there. I wanted to point out that we have Dr. Stephanie Holm, who has an appointment both at UC Berkeley School of Public Health as well as at UCSF, and she heads the Western States Pediatric Environmental Health Specialty Unit, and she is another co-I on the project. She is one of the national experts on the impact of poor air quality on children. We also have Jessica Liu, who is not here today, but is a senior project manager. Emma Sage is a staff research associate. She is another exposure scientist who is working with Jason Su on the modeling. And then Christina Lin. Christine, I don't think you're here, but if you are, give a shout out. She is an undergraduate student researcher, has been doing a lot of work on a survey with people who are deaf and hard of hearing. So a shout out to the wonderful skills of our team here. Next slide. These are our stakeholder advisors. When we began the project, as we do in all of our projects, we wanted to make sure we were using really intensive participatory design. That's one of the hallmarks of the work we do at Health Research for Action, always to use different kinds of participatory design, whether it's as intense as CBPR or whether it's another type of participatory approach that'll work. We're grounded in doing that. So we set about having a number of advisors who represent at-risk and hard-to-reach groups around California. So you can see here that we have folks from the Alameda County Health Department, where they have an asthma program on which Jason and I work to improve those kinds of interventions for children with uncontrolled asthma. We have several members of our advisory committee who are deaf and hard of hearing. Alina Engelman here is a former DrPH student who's now a professor at Cal State University East Bay. And she's been a long time collaborator of ours. Sherry Farina, likewise, and Ellen King. They are all members of the deaf and hard of hearing community. We have the director of the California Poison Control. We know that poison control is also concerned with the toxic impacts of wildfire smoke. We have 2 members from the California EPA. We also have members from the Hmong community, from the Fresno Center and the Hmong Cultural Center in Butte County. That's our work with the subgroup of Hmong populations. We have a member of the Yurok tribe in northwestern California. We also have the director of California Breathing. Ashley Kissinger is also a DrPH grad from our school. And then we have several public information officials. I want to mention here how important those are, because California has about 800 public information officials, and they are spread out in different areas, including public health departments, offices of emergency services, CAL FIRE, lots of different places have public information officials. And they're a very important group to get to with information about wildfire smoke exposure. And then we also have Aaron Weinberg, who's with, he's a head pulmonologist for Carbon Health. That's a group of urgent care clinics. And he came to us because we know that many healthcare providers really don't know a lot about the health impacts of exposure to wildfire smoke. And he was very concerned that they didn't have anything to train their staff at all their clinics or to give out to the public so that they could be more aware of their risk. Next slide. So another very fortuitous thing happened after we began our project in 2021. And that was, as some of you might know, and some of you might even be working on this, but that was legislation called AB 619 and about air quality. So this was enacted in late September, and it started implementation in 2022. And what this legislation requires is that the California Department of Public Health consults with stakeholders, and they create a plan with guidelines for all the counties to use in the case of a significant air quality event caused by wildfire or another source. And then it requires that the California Department of Public Health provide this plan to each of the counties. Then in turn, the counties are to use these guidelines to designate a responsible agency and create a county-specific plan in advance of their next emergency plan. And these plans must specify, for example, how they will provide accessible information about air quality and wildfire smoke to residents. And so the accessibility issue here is really important. It means that residents who speak a language other than English, or let's say who are deaf or hard of hearing or have another disability, they need to be able to access this information too. So since this legislation passed, we have been working with the Environmental Health Investigations branch of the California Department of Public Health to contribute what we learned to their efforts to develop a statewide air quality health plan, and then in turn to have that information go to the counties. Next slide. So early in this project, we defined a number of at-risk and hard-to-reach populations. We recognized we couldn't do something for everyone, although we do have some of the resources that we are developing will be useful for the general public. But we really want to focus on getting to the harder to reach populations that are often overlooked in public health work. And so one group is people who are deaf or hard of hearing. This is a group who suffers disproportionate injury and death in case of disasters. Wildfire smoke are disasters, but who are often left out of our efforts to do communication. So our group has been doing work with the deaf and hard of hearing populations for many years, especially on emergency preparedness, disaster communication. I wanted to note that Donna DeRouge is here among those attending this seminar, and she has been a wonderful partner to us over the years to support work with deaf and hard of hearing populations. We also wanted to work with Hmong groups. We had been working for many years, especially Winston Seng, with Hmong groups in the state. If you don't know a lot about the Hmong populations, they didn't until, let's say, a few decades ago have a written language. And many of the ways they use numbers are very different from the ways we use numbers. So their needs are quite different from that of the general public, and we wanted to make sure to work with them closely and get information that would work with their populations. Number 3, we wanted to work with people with asthma and chronic breathing problems for obvious reasons. You know, asthma, especially among children, is a really serious disease that is greatly aggravated by wildfire smoke and can be deadly. And so a lot of information needs to go out to people with asthma or other chronic breathing problems like COPD. Native American tribes, too, are often overlooked. Their preferences, their needs are often not taken in consideration when information is developed and sent out to the general public. And likewise, farm workers, they have high exposure to wildfire smoke and other pollution, but not necessarily engaged in developing and accessing information about these problems. Next slide. So one of the things we did early on, and certainly we would recommend this to any of you who are embarking on a project that is complex and where the solutions aren't really obvious at the beginning, is to do a design thinking workshop. Now, we've been connected for many years with IDEO, the premier design thinking firm in the world. They are headquartered in San Francisco. And so they were gracious enough to partner with us to hold a design thinking workshop at their office. And that was September of 2022. And these are really, it's a fantastic and fun way to get your advisors together, which we did, to explore issues related to wildfire smoke communication and also generate some rapid ideas for solutions. So even though this was just a half-day workshop, we generated a lot of really important information that has continued to impact our project. Next slide. Again, you can see some of our team and advisors here working together on ideas. Next slide. So literature review. Morgan, would you like to talk about that?
Yes, thank you, Linda. So in our year 1 of the project, we conducted a literature review, and this was a scoping review of peer-reviewed studies about wildfire smoke risk communications. The purpose of this was to identify gaps in research and evaluate communications and programs to educate the public about wildfire smoke exposure and reducing risk of exposure and the health outcomes and complications that result from that. We initially from our database searches, pulled in 451 articles, and our final sample size was 21 articles. And from those articles, we did thematic analysis and pulled out 4 different themes. So there's communication materials and messages, where the takeaway was that the articles called for clear and consistent language and evidence-based messages and multimedia approaches. So this includes anything from posting in the community centers to radio and TV, as well as internet and social media distribution. The second theme was delivery strategies, and this was dissemination of messaging via multiple local media outlets, and this is using local news sources as well as newspapers to really reach the community who was affected by wildfire smoke. The third theme is behavior change, and this is distributing information through trusted intermediaries and having consistency between messaging. So, for example, a message set out by a health official in the county would be consistent with a health message about wildfire smoke risk communication sent out by a local organization that is really in contact with the community. And the last theme, the fourth theme, is communications for vulnerable populations. And this highlights the need for prioritizing community engaged design and testing of communications for specific at-risk groups. We noted that there were only a few articles that covered anything about communications for vulnerable populations, and they specifically called out the populations that Linda has gone over in previous slides, as well as other populations that might have chronic conditions that affect their health outcomes for the wildfire smoke, disproportionate to the general population. And the need for vulnerable populations communications really pulls into the picture the importance of adapting the communications that really help these populations and meet them where that they are at. We have since published or submitted the manuscript for publication. It is currently in review in the revise and resubmit stage with BMC Public Health. As part of the needs assessment, we also conducted an environmental scan. The communications team led this, and the purpose was to sample existing wildfire smoke risk communication materials, and they were assessed for readability, suitability, and clear communication. Various tools were used, including the suitability assessment of materials and the PMAT tools as well. And the materials assessed were videos, websites, and brochures. From the environmental scan, the results included 19 information sheets and website pages, videos, and these were identified from 81 public-facing materials. These materials were about wildfire smoke exposure, and it was noted that only 5 of these materials were top tier in terms of the grading scales of the tools used, and no material could be considered a model for health literacy practices. So this turns us back to the critical and topical nature of this work to ensure that there are better health literacy and improved health communications and risk communications for wildfire smoke.
So Jason, tell us about the wildfire smoke modeling that's going on.
Thank you, Linda. So the work is actually done by Irma Sage, but she's not available today. So for us, what I typically do is do non-use regression models. So it's consider the impact of all sources. But over here, we want to see specifically the impact of wildfire wood smoke. So it's a source-specific impact. In this way, so we did a dispersion model called STILT. So basically, it hides for any location, or over here, it's the location of those communities we are doing outreach. So for each location, what we have been doing is to identify the impact of wood smoke for the entire year of 2018. So can you go to the next slide? I can come back to the first slide. So so over here we have 4 or 5 communities. So we are focusing on. So we use STILT modeling techniques to identify the impact of wood smoke for the entire year 2018. Then for those days, in STILT modeling, we use each location as a receptor. So basically for still modeling, you have the impact or meteorological conditions and plus the emissions. Emissions basically the wildfire particles driven by the meteorological condition to the locations of interest. So we modeled them for all the days, but not only the days, but also the sub days. Each day have 6 hours. Once you use the still to dispersion modeling, the results is kind of concentration, but most of the concentrations requires you to be very specific on the molecule weight to do the calibration to get the concentration. It's very, very hard to know exactly what's the molecule weight for the smoke. So instead of use molecule weight in the dispersion modeling, we used just assume the molecule weight is 1, then we model the concentrations and then use those concentrations to get to some of the locations. So we model not only for those 5 communities, but also some of the locations kind of far away from the highways, ports, but they have a minimum impact from the typical human impacts, have impact from the wildfires. So we use those to calibrate the model of concentrations, assume the molecule weight is 1. And one of the biggest challenges we have been doing for a month is it's very, very hard to get a very convincing power of prediction. And then after several tries, we found different time periods of the wildfire smoke would have the different impact on the government monitoring locations we used to calibrate. So we aggregate the data to those specific time periods and did a calibration. Now the adjust R-square to be exciting to the group, especially our research group. So it's 85%. So we'll use Emma could talk to some more. Use the calibration coefficient. We adjust the modeled concentrations to sub-daily across all the years for 2000, or for all the days, or even including 4 times in a day for 2018. So the minus curve will come out in winter 2023. That's great news for us. But Emma also did another thing is the she basically wanted to see if the Morgan, can you go to the previous slide? Okay. Emma also did one thing is to see if the monitoring stations are how dense are those ones to the general population or to the vulnerable communities. She checked government regulatory monitors for PM2.5 and also purple air for the entire California. You can see it from the top right side 2 figures. The much denser 1.1 is purple air. The other one is the regulatory monitors. She found that the vulnerable communities that have much lower density of the air quality monitoring. So that's part of the reason we are doing this, because for those harder to reach communities, they basically do not have any monitoring data for the impact of air pollution, especially so for wood smoke. I think I'll stop over here. Thank you.
Thank you, Jason. Yeah, this is quite a big job. And when this is completed and all the calibrations are worked out, then this model can be used anywhere to try to estimate exposure, even if there are lower numbers of monitoring stations there. So we really appreciate the novelty and importance of this. Let's move on to the next. Morgan, tell us about the work we've been doing with the Deaf and Hard of Hearing group.
Yeah, thank you, Linda. So our work with the Deaf and Hard of Hearing community subgroup has been wonderful, and we have really worked in partnership with this community and our advisors from the Deaf and Hard of Hearing community to identify priorities, evolve the approach, and then conduct a survey. So the priorities are to ensure that deaf and hard of hearing community members have full access to emergency communications and communication about wildfire smoke. And part of this too, as AB 619 came out, is to ensure that the deaf and hard of hearing community members are incorporated, the risk communications for this community are incorporated into the county plans and in terms of improving accessibility and reducing barriers to emergency risk communications. This approach has changed over time, and it developed from an informational handout or video into a statewide survey, as this would have farther reaching positive impacts. So working with our advisors, we drafted and finalized a comprehensive survey of offices of emergency services in California. And this will assess the integration and barriers around California for sharing emergency risk communications and what can be improved or adapted in terms of these communications, as well as accessibility. This will inform the AB 619 regulations and the air quality health plan work to improve accessibility about wildfire smoke and air pollution risk communications, particularly for deaf and hard of hearing communities, as well as people with disabilities. The survey will also seek to improve the state of offices of emergency services guidelines about accessibilities and emergency warnings with data using county and city responses. So we have outreach to 58 counties and 21 cities and have received responses and completed surveys from most of these counties and cities. Here is the sampling frame. So it is all of California's counties and the largest cities. And this is trying to capture the challenges by location in the ability to implement accessible emergency and risk communications. We are collaborating with many groups. In addition to our advisors on the deaf and hard of hearing community, we are also working with public information officials, as well as offices of emergency services and California Department of Public Health in discussions and outreach coordination. Currently, we are at 40 plus county and city respondents, and we are working with public information officials to increase outreach. This has been a success so far, and we are moving towards completing our survey collection around this month. We have about 50 counties as of now. We are working to complete data collection and begin analysis, and also connecting with California Department of Public Health on AB 619 and ensuring that the survey can really inform the efforts made in the air quality health plan. Future ideas include the call to action, and this is the push for more EPA materials for people who are deaf and hard of hearing. We are working on exploring funding opportunities, as it is difficult to prioritize funding for this group, and all the more critical to have enough funding to ensure continued work to improve risk communications for this community. Another future idea is public service announcements with American Sign Language for individuals who are well known in the community. So community representatives who can bridge and connect the community with the risk communications. We're also looking at video with American Sign Language and captioning, as well as a rap music video with a deaf local musician, or a play with deaf actors. So really pulling together the community representatives to uplift the community and ensure that the risk communication is improved and connected with the community.
Okay, so now we'll move on to briefly summarize some of the resources that have been developed using participatory design. Anthony, take us through this.
Sure. Well, as we may have mentioned earlier, HRA has a history working with the Hmong community. Over the years, we've had a number of projects with this community in California. And as such, we knew a good deal about their needs, not particularly in the area of wildfire smoke, but certainly as a community, we had a pretty good sense of how to work with them and what they might need. However, because of our process and the way we do things, we got to learn still more about their needs, specifically about this topic. But as you saw from the previous slide, that was sort of the list of future ideas for the deaf and hard of hearing community was mostly the result of the idea generation during design thinking, and something similar happened with the Hmong group, just many ideas. You know, as we progress past the design thinking stage of the process, we start to winnow those ideas and get a concrete sense of what we're going to build in conjunction with the community. And in this particular case, working with one of our two Hmong groups, the Fresno Center, we realized that one of the things that we needed to communicate most clearly was the need to check the air quality before you go outside, particularly at certain times of year, and to explain the AQI. So we settled on a resource, again, after a lot of talk after the design thinking workshop in conjunction with the communities, on a really brief brochure. And on the face of that brochure is a magnet with a QR code that takes you to the Air Now sites, and you could check the current air quality. But inside of that is the brochure is an explanation of how to respond to the AQI, which can be confusing to people. It has some, though it's sort of well-meaning in ways, it also, from a health literacy perspective, is not the clearest. It doesn't give the clearest direction. It's kind of general, it's certainly written at a high level, et cetera. So we're just trying to give people very clear directions in terms that they understand as to how to respond to AQI levels. But the first thing was really to get them to understand the importance of checking and to encourage them to do that. So on the face of this brochure is the magnet, and the magnet's supposed to be on a fridge, similar to like the CPCS magnet. And you just scan it before you go outside. You can even just download the app, which we also encourage people to do in order to accomplish those tasks. So this piece, of course, we wrote in conjunction with the Hmong community. We developed the design, so they settled on, like any other communications resource, they settled on, you know, a look and feel. We then fleshed out that design further, did some iterations of the brochure. And at this stage, and we can go to the next slide to get a sense of what it looks like. We're currently about to test this with users. So as we said, you know, we invite lots of stakeholders to provide feedback, to provide direction, et cetera. But one of the most valuable is really to go at the ground level and take the thing that you've created, or some version of it, a draft version of it, even something more rudimentary than this. And this is really kind of second draft level here, and to bring it to the people you're trying to reach and communicate with, and see how they respond to it in one-on-one interviews. And that's what we're currently doing with this piece. As you can see here, very simple in terms of layout, in terms of the messaging. One of the things that we found in our scan, really in lots of public health risk communications, is just everyone trying to accomplish too much with a small piece. And what we kind of focus on at HRA is keeping the messages simple, and not trying to you know, blow up the scope too broadly. So here again, the top piece is sort of the front cover all the way to the right, the back cover to the left, and then the bottom piece here. And again, just a 6-panel brochure. Is the interior panels of the piece. Of course, we work to translate this material and have it reviewed with the community as well. So moving on to the next slide. As I mentioned, we were working with two groups, and the Hmong Cultural Center in Butte County had some slightly different needs. Their community members at the center anyway tended to be just a bit older. Of course, Hmong is famously not a written language, so we wanted to do something auditory as well. What they really wanted was a conversation starter for their community members. So we decided to do a few things at first, but eventually landed on a motion graphics piece, for which we developed really simple, clear messages about checking air quality, staying indoors if the air quality was bad, if it was possible, et cetera. Really just keeping it to 3 main messages. So we composed the video script with the team, moved on to storyboard stage. It says here we're developing an alpha edit, but actually it's now developed. We're at that stage where we're ready to present it to the community. It's basically the draft version of things. It's a little you know, not smooth around the edges, I guess you could say, in terms of an edit, in terms of the voiceover and all that, but once we settle on the details, then we move toward a more final and smoother looking version of the video. But right now it's about 1.5 minute video, 1:40 seconds, and really simple visuals like this to give you an idea how iterative our process is. This image is no longer in the video. It's always kind of changing until we get it either just right or just right enough for that particular community. Moving on to the next slide. Another thing that we found in our scan is that there weren't really many or any materials at the time anyway that spoke to people who have chronic breathing problems and how they might prepare for wildfire smoke, how they might avoid wildfire smoke, of course, how it might affect them, etc. So we, working in team with some advisors on our committee, particularly looking toward their ability to distribute material widely throughout the state, we wanted to put something together very simple, just a double-sided leaflet, which is something we don't often do because leaflets tend to be not as well cared for as other materials when they're handed out to community members. But in this case, we felt that material was needed and needed to be distributed widely and cheaply. So we did develop a double-sided sheet. We wrote and designed it, had everybody kind of weigh in on it. We worked very closely with Dr. Holm to develop the content. And the participatory process led to, I guess now we're on version 5 of this, and usability testing it with lots of users. And just to go on a little bit more about how we do usability testing, we generally, depending on the size of the material, test with about 6 users. The interview is about 45 minutes long. We look at a number of things, but mostly how people initially react to a material. And we find that that's super important because we can know right away if there's a barrier to understanding for them, if their immediate reaction is not positive, and for whatever reason that might be. But usually it's because it's a dense block of text in front of them and they tend to not have high literacy skills, the people we test with. So we get a pretty fair idea of how, a random person might respond to the material we're developing. So, and again, those tests then, generate or lead to some revision, and then we create a new version, and on it goes until at least enough people are satisfied with it that we have a solid version. So if we move on to the next page here, you'll see like the first version of the sheet, which is, I wouldn't say it's dense, but certainly both are a little text heavy, frankly, but you can see the change in approach, right? So the first approach looks like just about every single wildfire communication material that's out there on public health websites. It's not particularly inviting. In fact, it's a little scary. So we smoothed out the edges as we went to more of an illustrative way here. And this isn't the current version. The current version is, I would say, more than slightly different from this. But you can see there's a pretty big departure between versions 1 and 3, and now between 3 and 5 as well. But again, really simple content, easy to read formatting, lots of signposts for people so they know what information is coming and what the information is about, whether or not it's for them, etc. And fairly straightforward. So you can push on to the next slide. As some of you may know, HRA publishes with First 5 California a parent guide in California, and it's distributed to over 200,000 families every year. We've been doing this for on and off for about 20 years. And that guide is a fairly lengthy resource. And First 5 publishes it at considerable expense every year because people keep requesting it. And one of the things that we wanted to do, we thought was a pretty easy win for distributing risk communication on wildfire smoke throughout the state, was to put a really clear and usable chapter in the guide about wildfire smoke. So we, on this previous print run, just last month, we published the latest version of the parent guide, and in it there are 2 easily findable pages on wildfire risk communication. And again, this is distributed to low-income families throughout the state via hospitals, Head Start centers, programs, that kind of thing.
Okay, so those are some of the resources, and just wanted to underscore what everyone has been saying is that when you use the participatory approach, you have many iterations. You really get down to the nitty gritty of what people want, and you also have to think a lot about dissemination at the same time that you are developing a resource to make sure it's going to be used in the end. So one of the groups we're working with is Alameda Asthma Start, and Jason and I have been working with this group for a number of years doing research on the impact of their program, and found really good outcomes, a great reduction of emergency services use by reduction of hospitalization by 80% and reduction of emergency department visits by 50% when this program sends field workers to the homes of families on Medi-Cal who have children with uncontrolled asthma. So one of the things we've introduced here is working with them to integrate the new resources about asthma into their program to educate parents. And then we will be doing a pre-post intervention study to evaluate how this new information affects people's knowledge, confidence, and behaviors related to dealing with wildfire smoke risk exposure. Next slide. So we are doing some work with the Yurok tribe. They're a tribal nation in northwest California, the very top of California. They have a lot of wildfire smoke exposure every year. They also have problems of being low-resourced community, poor housing quality, and so we really appreciated their environmental director there, a tribal member, who's joined our team to advise us on the issues there and what might work out. One of the things we've been learning a lot about is the inherent knowledge in a tribe like the Yurok tribe or many others in California and elsewhere with the value of doing prescribed burns to help reduce out of control wildfires. Now they are called by tribal nations, that is called cultural burning because they have done this for so many years. We've lost that knowledge and now it's coming back, and nationwide there's a lot more interest and activities around prescribed burns. So our tribal partner is going to be help review a statewide resource on prescribed burns for the public. And we're very appreciative of that. That's coming out through Cal EPA. Next slide. So that covers pretty much what we've been doing. We would appreciate any comments or questions. We still have a few minutes left. So please just do a shout out here or put questions or comments in the chat.
Wonderful. Thanks so much, Linda and team. If folks have any questions they'd like to ask, like Linda said, pop them in the chat or raise your Zoom hand if you'd like to say your question live. I have a question for all of you, since we do have a minute or so left. Is there a group you might have wanted to engage on this that just, you didn't have a chance to expand the scope? Do you have a wish list of next groups to engage?
Well, we would like to do more with farm workers. And so we had a farm worker partner, but they had to drop out. And so now still with our work with the Hmong group, that they have a lot of people in rural areas and that includes farm workers. So that's helpful. But that's a group we would like to do more with. Now, what we're very happy about is that some of the partners, collaborators that we are working with in other EPA-funded wildfire smoke projects, there are actually 3 other projects in California, and we formed a mini collaborative, and a number of them are working with farm workers. So that is a way for us to get information and think more about it. The information from The parent kit does go to farm workers through WIC, Head Start, and other programs. So we will reach them anyway, but certainly would like to do more with them and with low English speaking populations.
Wonderful. Thank you. Thanks everyone for joining. We're right at 1 o'clock. So everyone enjoy the rest of your afternoon, and look out for announcements about research seminars for spring, because this is our last one of the fall. Thank you all, HRA team.
Thank you,
Thank
Jag.
you. Appreciate
Thank
it.
you.
Bye.
Thank you.
Bye-bye, everyone.